Hello, everyone. My name is Joey Grover. I'm the medical director for Orange County Emergency Services. I'm going to be talking to you today about glucagon and its uses in the pre-hospital setting. For those of you who don't know, our scope of practice at the EMT level was expanded in 2023, where glucagon was added as a medication that could be administered by EMTs in the pre-hospital setting. Part of the reason why this was done is that there was a recognition of the need of glucagon as an emergency medication and the expansion of glucagon to multiple different settings outside of requiring a standard prescription. Currently, if you were to go to a pharmacy and request glucagon, a pharmacist is able to provide glucagon to an individual similar to how naloxone is provided without requiring a standard prescription. And so, for that reason, if a 12-year-old could walk into the pharmacy and request a medication and be able to administer it, there really wasn't a lot of understanding why a pre hospital provider who is well trained in other interventions couldn't also utilize glucagon. So, for that reason, the scope of practice was changed. So, how does glucagon work? So, glucagon is a naturally occurring hormone. So, it's produced by the pancreas and it stimulates the release of glucagon into the circulation. And it does so by multiple different methods. Part of the goal is to get a rapid rise in your glucose level through the use of glucagon. And so, it's going to do this by any means necessary. It's going to lead to breakdown of a standard glucose storage molecule. It's called glycogen, which is stored in the liver. It's going to lead to the production of glucose, so that's gluconeogenesis. It's going to break down fatty tissue and muscle tissue in order to generate a rapid rise in your glucose levels. And so, using all of those techniques, the goal is to get a sudden rise in glucose when your glucose levels were extremely low. So, think of it as almost like an emergency mechanism of your body to get glucose into your circulation. Interestingly, though, this only works if you have stores of glucose in your body. So for those patients who are chronically starved, unfortunately, giving glucagon may not lead to much of a rise in glucose. So, some of the examples of patients we sometimes see are those patients who, what I usually describe as like that starving alcoholic, the patients who only drink alcohol and don't eat any food. Those patients sometimes present, very thin appearing, very ill appearing, and may not have any of the standard glucose stores. So if that patient presented with a low blood sugar and you were to give them glucagon, you'd find that it really wouldn't cause much of a benefit. So the only intervention in those types of patients is to actually give them dextrose through the IV. So the reason I mention all this is to say glucagon is an amazing drug, but it's not always going to be the saving drug that we hope for. And there are going to be situations where we really do need that paramedic to put in an IV and give IV dextrose. So what's the protocol going to look like? Well, interestingly, it's relatively simple. It's simply changing the P for a B. So if you think about what our protocol currently looks like, all we're going to be doing is indicating that same intramuscular 1 to 2 milligrams of glucagon to be given by an EMT instead of a paramedic. We are actually also requesting from the state permission to be able to give it intranasally as well. So there's a different formulation of the drug that can be used where you can give 3 milligrams intranasal. And interestingly, it's been shown to be similarly effective as the standard intramuscular dose. So, what are some of the disadvantages of the current intramuscular modality? So, one of the problems is that it has to be reconstituted. So, it's actually stored as a powder. And therefore, in order to be able to administer it intramuscularly, you have to mix it with sterile water and get it into solution to be able to then intramuscularly administer it. So how is it stored? So there's a couple different ways you can go out and find glucagon. The first is these emergency kits. These are actually quite expensive. And what it has is an inline mechanism whereby you can push the sterile water into the glucagon and then draw out the glucagon all within one single line. So the idea being that you're not having to pop open multiple vials to be able to do this pathway. So it is somewhat simple. Unfortunately, just having that same circuit created leads to a higher cost. The cheaper mechanism is actually just storing the two medications in separate vials, which is what Orange County currently does. So you store it in a box with sterile water and the 1 milligram of glucagon. And simply what you have to do is draw up the sterile water, inject it into the glucagon vial, swish the vial up so it becomes in solution, draw it up, and administer it intramuscularly. So it does take a couple extra steps. As I said before, the red emergency kits are probably the most simplistic mechanism available. But once again, the problem is cost. So once again, if you're looking for the cheapest option to be able to administer glucagon, this is going to be it with regards to just having two separate vials. The process, as I said, involves you draw up the sterile water, you inject it into the glucagon vial, you swirl up the glucagon vial until you can no longer see the mixture and it's actually all in solution. Then you draw it up and you can administer that 1 ml as an intramuscular injection. As I said before, there is actually an easier alternative. So intranasal glucagon has actually been studied for a number of years. It doesn't require reconstitution. It's basically a vial that you administer similar to naloxone, where you literally just squish it and you get this powdery substance that can get absorbed. And it actually has been shown to be similarly effective. The problem is costs. A lot of the times, the intranasal version unfortunately is a higher cost than the standard intramuscular dosing. But the biggest advantage is it really doesn't require any additional training because the training to administer this is very similar to the training that we already use for most of our law enforcement or pre-hospital providers with regards to naloxone and other intranasal medication. So the biggest advantage here is there's no real downside from a training perspective. You could basically roll this out very quickly. And as I said before, I think the biggest advantage is that it has a similar effectiveness. It does have a slightly longer onset time. So those patients may take a little bit longer to have normalization of their glucose than the patients who got the intramuscular dosing. And so with that, once again, if there are any questions about the rollout of glucagon, please reach out. Our hope is that this rescue medication will be more available than it currently is through this new scope of practice change so that more EMTs are able to administer this medication out in the field. Our BLS units are going to be going live with this as well. And so our hope is that for patients who are suffering from hypoglycemia and there isn't a paramedic on scene, that glucagon will be more readily available to be administered. So thank you so much for all of your time. I really appreciate it.